Good morning, this is Etta Rodriguez, and I'm happy to welcome you to the Florida Health Grand Round, hosted by Public Health Research at the Florida Department of Health. We are excited to welcome Dr. Liller today as she speaks about child and adolescent injuries and injury prevention. A special note that April 22nd through 26th is National Every Kid Healthy Week. Just a few reminders before we get started. All phone lines are muted today, so if you have any questions, please go ahead and type them into the questions feature, which should be on your control panel for GoToWebinar. Also on your control panel, you will find two handouts. The first being some resources Dr. Liller will talk about today in her presentation, as well as a copy of the presentation if you would like to print it out, take any notes, or just refer to it later. For those of you who would like to receive continuing education credits, there's been a bit of a change. We are no longer able to provide medical continuing education credits, and we will only be providing nursing continuing education credits. To receive those, please complete the survey that will pop up at the end of this presentation, or there is also a link included in the follow-up email. You only have to complete it once. It's important that you include your name, license number, and the prefix to your license, whether that be RN, ARNP, etc. Make sure the license numbers are correct so we can give you that continuing education credit. And then today we have Dr. Karen Liller presenting. She is a professor at the College of Public Health at the University of South Florida. Dr. Liller's teaching and research focuses on the prevention and control of children's unintentional injuries. Her work has been recognized through the first State of Florida Injury Prevention Award, the Tampa Bay Business Healthcare Hero Award, and she has been named as a Fellow of the American Association for the Advancement of Science. Please join me in welcoming Dr. Liller today.
Well, hello, everyone. Thank you for coming to this presentation. I'm excited to talk with you today about a topic that's near and dear to my heart and certainly been my research focus for now over 20 years, and that's injury and injury prevention for children and adolescents. I thought how I would do the presentation is go over some general information about injuries and then talk to you about the results of a recent study we did on sports injury research for children and adolescents. So I just wanted to say that I have no disclosures related to this presentation to report. First of all, if we can talk about injury statistics, every year, the latest data from 2017 show that over 243,000 Americans die as a result of injuries. And if you know the field, you know, though, that injuries are really only, the deaths are really only the tip of the iceberg because many, many more people are injured and don't die. For example, the CDC says in 2017, over 14,000 children were killed due to injuries. However, over 7 million suffered non-fatal injuries. So this illustrates how many more individuals are injured but do not die. So what about injuries worldwide? Well, according to WHO, there are actually more than 5 million injury deaths every year. And when you look at the international data, while violence and injuries account for only 9% of global mortality, that's a lot because that's as many deaths as from HIV, malaria, and TB combined. Also, throughout the world, injuries like in America result in tens of millions of hospital emergency department visits and overnight stays. And like many things in public health, whether we're talking about diseases or injuries, people who are at the lower socioeconomic levels are at greater risk. They suffer worse consequences, and unfortunately, they do benefit less from our prevention programs. And we'll be talking more about that in a few minutes. The majority of the leading causes of death for people 15 to 29 across the world are injury related. And leading the pack are road traffic injuries. Also, we have suicides, homicides, drownings, burns, war injuries, poisonings, and falls. Now, when you see the number of road injuries across the world, it brings you to the understanding how important prevention measures are. And we know that seat belts and child restraints in vehicles have truly been life-saving devices. In fact, they're among the most best buys that we consider in public health. In fact, the issue with this is wearing a seatbelt or having your child in a child safety seat is going to reduce the risk of a crash injury or death because it's going to reduce your risk of being ejected from the vehicle. Ejection greatly increases your chances of injury and death. In fact, being in a seatbelt can reduce this by 40 to 65%. Also, the seatbelt slows down your motion a bit as it absorbs some energy, but the seatbelts and child restraints are absolutely critical. And talking about road injuries, every third Sunday of November across the world is a day of remembrance for road traffic victims. And this is done to support family members and friends dealing with the loss of someone they loved. And you can see events all throughout the world, and it's very heartwarming because this is in America around the time of Thanksgiving. Well, road injuries are not the only problems worldwide. Every year, over 300,000 people die from fire-related burns. And just as I just said, many more people live with an injury rather than die. Millions more are left with disabilities due to fire-related burns and disfigurements. And this is the one injury that people suffer so much from stigma. And also, I am told that this is the most painful of injuries. In fact, burns are the only form of injury, though, that kill more women than men. And when I teach this in my courses, I often ask the students, why do you think that is? And obviously, they come up with the reasons that women may spend more time cooking than men across the world. That's true. And it also has to do with clothing. It also has to do with women being in more free-flowing clothing than men. And there have been strategies that have been successful for this, such as elevated cooking stoves. In some countries, the stove is right on the ground. If we elevate it, that seems to prevent some of these injuries. Smoke detectors, of course. Regulation of water heater temperatures. That temperature should be 120 degrees Fahrenheit. And flame-resistant children's sleepwear. These are among our proven injury prevention techniques. Well, burns are not the only other injury. We have the poisonings, and we'll talk more about these later. But across the world, about 23,000 children die every year as a result of poisoning. However, hundreds of thousands live but accidentally ingest poisonous substances. And of course, in the United States, in 1970, we passed the Poison Prevention Packaging Act, which greatly saw a decrease in our number of poisonings in children, and that was due to the child-resistant closures on many of the prescription drugs that we have, as well as different products, as well as decreasing the number of medication available. But as we've seen recently, we're seeing some increases in this, somewhat due to the opioid problem. So where do I get some of these numbers? We're going to follow soon with injuries in the United States and in Florida. And rather than interrupt the presentation, perhaps we can look at this data, we can look at this website after my presentation. This is called Whiskers. And Whiskers is the web-based injury statistics query and reporting system of the Centers for Disease Control and Prevention in Atlanta. It is run by our National Center of Injury Prevention and Control that's there. And it is a very easy site to find morbidity and mortality data. And if we just look at Whiskers, which I hope we can do at the end here, for Florida alone, in 2017, 909 children and adolescents, and I'm using the ages of 0 to 19, died due to injuries. Our leading causes of injury death for these children were unintentional injuries, and this is defined as injuries done without harmful intent, suicides, and homicides. In the United States, as well as mirrored in Florida, motor vehicle traffic events are the leading cause of death and injury death for children 0 to 19. Homicide, though, has become the fourth leading cause of death for 1 to 4 and 5 to 9-year-olds. And this is something that has surprised some people. We don't fully understand why this is happening, but suicide is now the second leading cause of death for 10 to 14-year-olds and 15 to 19-year-olds. And I've recently found data that has shown we've seen increases in injury mortality across the United States for 10 to 19-year-olds. In fact, the total death rate of all reasons for death declined 33% between 1999 and 2013. And this is a great, great achievement in public health. In fact, one of the greatest achievements we've had in past decades has been this, the decrease in injury rates, especially for children. However, what we are seeing between 2013 and 2016, we're seeing an increase now of 12%. This recent rise, and this is the total death rate. Why are death rates going up? This recent rise is due to an increase in injury deaths in this age group. In fact, while unintentional injuries declined 49% between 1999 and 2013, they too now are going up. We've seen an increase of 13% between 2013 and 2016. And if you look for suicide, while the suicide rate declined 15% for these children between 1999 and 2005, we have seen a 56% increase between 2007 and 2016. The homicide rate also declined 35% in recent years between 2007 and 14, but again, in 2016, we're seeing a 27%, which tells us we're not done when it comes to injury prevention. We're seeing some recent increases that do need to be addressed. Also, from the Children's Safety Network, which is a great source for injury information, I also know about injury disparities I'd like to share with you. Generally, for these ages of 10 to 19, males have higher death rates and hospitalizations, and this is true pretty much across injuries. And we also see American Indian, Alaska Natives for 10 to 19 do have the highest suicide rate. Blacks and Hispanics, ages 15 to 19, are at increased risk for homicide and assault, and Black children are at increased risk for a variety of injuries, whether they be fire or burns, drownings, pedestrian, and falls. And Black infants are at the greatest risk for unintentional suffocation deaths. We do know, though, that the injury mortality rate is lower for Hispanic infants and children, some of the Hispanic paradox there. But we do know whites ages 15 to 19 have higher rates of combined suicide deaths and attempting suicide, and they tend to use more substances, including prescription drugs. So some other injury disparities, not surprisingly, children in the South have higher drowning fatalities, and that's probably due to the weather and the bodies of water. Rural areas have higher suicide rates generally, urban areas higher homicide. And unfortunately, children with disabilities tend to have higher risks for both unintentional injuries and those related to violence. And the LGBTQ populations do have an increase for suicidality or thinking thoughts of suicide, non-suicidal self-injury, bullying, assault, and physical dating violence. These are areas that need much more research in the injury prevention field. And as we said earlier, socioeconomic status is very important. Low SES backgrounds put children at higher risk for infant mortality, drowning, assault, and fire-related injuries. In fact, those in the lowest SES groups have nearly 3 times the unintentional injury or homicide rate. And when you look at county-level poverty, that is associated with unintentional injury mortality. And that's across the country. When we also talk about injuries, we also use this term of YPLs, or years of potential life loss. And what that is that let's say that your life expectancy is in America, let's say that it's 76 or 77 years. And what happens if a child dies at the age of 4, let's say due to a drowning, they've lost 73 years of potential life. So that YPL, or that potential years of life lost prematurely, would be 73. And if we add all these up, basically for injury, we see that injury leads the pack. About 3 1/3 million YPLs are lost each year prematurely, as compared to less than 2 million for cancer, 1.4 million for heart disease, and about 1/4 to 1/3 of a million each for HIV, cerebrovascular, and liver disease. And this is because injuries are the leading cause of death for children and young adults. So what's happening is you're getting many more years of potential life loss due to injury. So what have we been able to do through the years? We've had many successes, but we have much to do. We have done the public health approach, which has been greatly received. We have of course, first surveillance. We understand the risk factors. We then do smaller scale interventions and evaluation, and then wider implementation. Injuries lend themselves nicely as well to remembering the core functions of public health, which we definitely do a lot of epidemiology before we go out and do prevention programs for assessment. Policy has been a true friend of injury in many cases, laws and regulations, and of course, assuring different services. Now, injury prevention efforts, if you've been in the field, you'll know what I mean by the 3 E's. The 3 E's have been around for a long time, and we've known that education is important, but also is engineering, better products, better roads, and enforcement, right? Enforcement of laws and policies. Now, the 3 E's, as I understand it, have been expanded. They include things like evaluation now and some other things. But the injury prevention field has really just moved forward so well during these past 3 decades, because it started out, the injury prevention field really started out in traffic safety. And back in the 50s and 60s, basically it was just pure giving out pamphlets, telling people to drive better, those kinds of things in terms of a health education approach. But since that time, we've realized we need to do much more. So now we rely much more on socially based policies, environmental changes, as well as education. We've also followed the Haddon matrix. And again, if you know injury, you'll know about Dr. Haddon. He's one of our great pioneers. And in the early days, he was the one that said, we can study these injuries like we do a disease. We can use the epidemiological model where we look at the host. What is it about the host? What is it about the agent that's causing the injury? Now, while not going to spend a lot of time on this, the agent actually for injury is energy. It's the energy is so great that the body can't dissipate it and you actually become injured. But then you have the vehicle that carries the energy. So in the case of a car crash, it would be energy of motion that leads off into the injury or kinetic, and the vehicle would be actually the motor vehicle. But anyway, the agent causes the injury, and the environmental factors are important too. The environmental factors include both the physical factors as well as the sociocultural factors. But interestingly about the Haddon matrix, he didn't stop there. He said, we need to study those factors over time. So what he means by over time, you look at the host, agent, and environmental factors at first a stage called pre-event. Pre-event would be like pre-crash. You have not had the crash yet, if we keep it with the motor vehicle example, but that includes everything about the host, the agent, and the environment that will determine whether a crash will even take place. And that includes, for example, the host would be like your ability to withstand an injury, your physical state. Are you under the influence? Are you a child? Are you a rambunctious child? That sort of thing. The agent would be the vehicle, let's just say, and it would be how safe is your vehicle? How are the tires? How are the brakes? What's the condition? And the environmental factors, what environment will you be going into? Is it a dangerous physical environment? And also the sociocultural environment is important too. How does your community think about injury? Do they practice the laws? Do they enforce the laws? So you look at all of those factors at pre-event before anything's happened. And some people like to refer to this also as like primary prevention, if you want to use in the prevention language. And then during the event, the crash, we look at the same factors, the host, agent, and environment, and look to them to see what determines whether an injury results from a crash. And as you might know, just because you're in a crash doesn't mean you'll be injured. So what is it about the host? Can you withstand this particular energy exchange? What is it about the vehicle? How does it react in the instance of a crash? And also the environment. What happened in the crash? What environment? Is it with another vehicle? Is it with something in the road, with an object, etc.? And then that would be more like secondary prevention, if you will. And then post-event or post-crash, again, we go back and look at the host, agent, and environment. And we look at what about those factors might decrease the severity of the injury's consequences. So the host would be, again, this involves a lot of how quickly we can get to you if you've been in a crash, and also your access to trauma care and trauma care facilities. So the Haddon matrix has been very helpful because it really dissects an injury, and it also leads us to understand how we can prevent them. I've also used the Frieden Health Impact Pyramid a lot. Dr. Frieden was the prior director of the CDC. And he came out with a pyramid that shows that we're going to be much more successful in public health if we focus on the lower tiers. We're going to have a much more greater impact. So for example, tier 1 is socioeconomic factors. If we address those, we're going to have a greater impact among populations than some of the higher tiers. Tier 2 is changing the context to make the default decision healthy. What this means is safety is the default. If you get into your car today and you hit your brake and you have anti-lock brakes, or if someone gets in a crash today, unfortunately, and their airbag goes off, that is all a default. You have nothing to do with that, it happens. So that's tier 2. Tier 3, long-lasting protective interventions are things we can do. For example, if you're in a home and you put gates at the top of your stairs so children can't fall down the stairs. If you have young children, that's fine. That could be long-lasting if it stays in there and if you actually make them a permanent or semi-permanent part of the home, but someone could come in there and actually remove them if they could. And so therefore you can see that the effect is lessened. Clinical interventions, physicians and other health professionals can do interventions. For example, a physician can give an elderly person calcium to make sure their bones are strong or recommend things to prevent fractures in falls. And then tier 5 is counseling and education. And what you can see as you go through the tiers, we're getting more and more and more and more individual versus a population change, which would be more around tier 1 and tier 2. The problem with tier 2, it sounds very good, but people have to have access, right, to the vehicle if you're talking about safer vehicles. So that's why socioeconomic is more at the tier 1. So injury risk factors, as we study injuries, we have the Haddon matrix, we have the Frieden pyramid, but we have to understand risk factors in great detail. And it used to be that we would consider risk factors for unintentional injury and violence, which we include homicide, suicide, legal interventions. We would consider those separately. However, we have learned that the risk factors actually overlap these two areas. And some examples include alcohol and substance use. If you think about it, alcohol and substance use can be a risk factor for both unintentional injuries. You can, let's say, use substances or alcohol and unintentionally have a motor vehicle crash, or they can be used in situations of violence. Economic disparity, the same situation, right? Economic disparity, if you don't have enough money to buy the safer vehicle, if you don't have enough money to put safety features in the home, that can set up both an environment for unintentional injury as well as perhaps violence. Discrimination and bias, the same thing. The built environment, if our environment is safe, then it may prevent less unintentional injuries, but also if it's a dangerous environment, could set up instances of crime and violence. Product design, same thing. Product design, some products are designed and if they're not made properly, you can have an unintentional injury or they can be used for violence. Risk-taking behavior, absolutely. Risk, if you are taking a lot of risks, that can set the stage for you to have an unintentional injury or become more violent. Timing, generally we see many injuries happening in July. So that's much due to people being on vacation, people being out and about outside. So we see more of the unintentional as well as some increases in violence. Mental health absolutely cuts across both. If you're having mental health issues, that can affect unintentional injuries. You can become less aware and be unintentionally injured, or perhaps this can be related to violence. And of course, the media. The media, the way they portray both unintentional injuries and violence is very important. So we have those risk factors that cut across, but thank goodness we also have resiliency factors that also cut across. My father was a banker and he always said everything comes back to money. Everything comes down to money. So financial capital, absolutely, but just throwing money at the problem won't fix it. We have to know what to do with the funds, how to set up good research designs and follow through with evidence-based programs. Community facilities, absolutely. The role of community partnerships and support. We have some students here now. One of my doctoral students is doing a study of looking at violence and weapon carrying, and what affects that in the community. And one of the things that she's showing is the importance of social cohesion in a community and how that has such an effect on young people and weapon carrying. So that is very important. Community partnerships and support, absolutely. For children, parenting and role models, yes, and access to decision makers. The more access you have to people that can make changes, the better. So saying all of that, and I know, I'm sorry if that was rushed a little bit. Normally we teach this over a whole semester, but I wanted to give you a good background of how I've taught injuries and some of the things we look at. I want to go over a study that we did in 2016 and 2018 that you may find of interest. For the last decade or so, I've studied sports injuries and concussions. And right now, we're also moving into the area of violence, but I wanted to share this with you because I think it brings home many points. Our last study looked at 5 to 11-year-old children in Hillsborough County that were playing sports in local recreational leagues. Now, this study is unique in a couple ways. One, we studied 5 to 11-year-old children. Normally, sports studies will focus on high school or collegiate athletes or even professional athletes. So this was unique. No one was really studying the 5 to 11-year-olds. And also what makes it very different is that we are looking at local recreational leagues. Most of the studies have been done in schools. They've been done in sanctioned sports in middle schools and high schools, in college settings or professional. But these are the local leagues you see in communities. For example, you'll see the Hillsborough County Soccer Club or something like that, that really no one was actually studying. So I'd like to thank my study researchers, Dr. Morris, who is now with the Florida Hospital Wesley Chapel. Yingwei Yang is my doctoral student, Dr. Bubu, who when he was here, Brad Parrish, and truly the heroine of the study, Jessica Falian. She was our certified athletic trainer that did so much of the work of this. The project was funded by NOCSE, which is the National Operating Committee on Standards for Athletic Equipment, and USF also provided funds. And just a little bit of a background, the literature does show that there are about 1 million sports injuries reported every year to 10 to 17-year-olds across the country. And sports injuries lead to losses of thousands of dollars each year. And in fact, if a child is going to be hospitalized at school, most likely it's going to be related to a sports injury. So as I said before, we have minimum data available on injuries and exposures of young children that play in these recreational leagues. And what I mean by exposure is that how much the child is exposed to the sport increases their chance for injury. So it's very important when you look at sports data that you also consider exposure. So this is what we tried to do. We tried to collect and analyze both sports injury and neurocognitive data, which you can call concussion data, on children ages 5 to 11. They're playing in the leagues from 2016 to 2018. And as with all of my studies, I tried to end up making targeted recommendations for strategies to prevent the injuries. So how we did it, we hired a certified athletic trainer. She collected the injury and the exposure data. Now, how we calculated exposure is we did it the way that the tool that we used, RIO, that you see below, it's the way that those researchers defined it. The number of athletes at each competition or practice is actually exposure. And we looked at the sports of baseball, softball, soccer, and football. And they were all played at a very large athletic facility in West Central Florida. In order to collect the injury data, we used RIO. RIO, you can Google this. It is now based at the University of Colorado. It's known as Reporting Information Online. This is where the certified athletic trainer can stand on the side of the field, use her laptop or his laptop, and collect much information about the injury, the mechanism, the weather, the time of day, the extenuating circumstances. So we learn an awful lot. We also used a fairly new tool called Impact Pediatric. Impact Pediatric Neurocognitive Test was developed by the company Impact, and you may know this company because high schools and middle schools now are using their tool for baseline numbers in case a concussion occurs. This was their test case. We were one of their test cases to test a new product for pediatric use. This again was for ages 5 to 11, so it fit our study well. Impact Pediatric, as I'll explain to you in a minute, is done on an iPad. And because the children are 5 to 11, and I'll show you some of the questions, we had to read each question to the child because we weren't sure that, all of them could read, especially the 5-year-olds. Now, we do these tests at baseline. And the reason why we do that is because, as you know, in the state of Florida, as in other states, if a child is suspected of having a concussion, they are to be taken out of the game. And they're not to return that day. They are to be seen by a medical professional before they can return. Sometimes the medical professionals would like us to do a follow-up to make sure the follow-up matched the baseline. And sometimes parents made requests as well. So the collection of all of our data was approved by USF, our Institutional Review Board, or our IRB as we call it, and the Hillsborough County Athletic Association. So one of the things I wanted to define for you, though, is how we defined a sports injury. Because if I had 4 people in the room with me right now and I said, what is the definition of a sports injury? I would get 4 different definitions. So that's the thing about injury. When you study them, you have to make sure everybody's on the same page with a definition. For us, these injuries occurred as a result of participation in a recreational league competition or practice. Now, what that means is we were there for the competition or practices, and we were not there, for example, if the child played at home that night and got hurt. We were only looking at those that occurred while we were there. Requires medical attention by a team physician, a certified athletic trainer, someone had to see the child, so it was serious enough that it needed medical attention. And also was serious enough that it resulted in restriction of the athlete's participation for 1 or more days beyond the day of the injury. So once again, we were not really looking at injuries that were very minor. We were looking at those that actually removed the athlete from play for 1 or more days. However, any fracture, heat illness, concussion, or dental injury, regardless of any type of restriction, was reported. Impact Pediatric is this iPad design test, as I mentioned, and some of the categories we tested with the children were wordless, design rotation, where you had a design, and if we rotated it, they had to match it. Stop and go, that was to detect reaction time. And if you remember the old picture match games, we had picture match, they had to match pictures, memory touch, etc. And what we were looking for their ability to sequence and pay attention, word memory, visual memory, and reaction time. And again, as I said, the athletes completed the testing on iPads, and we provided the iPads. And I had to have many certified athletic trainers, not just one, do this because of the time that it took. The ATCs have to receive training on using the tool, and as I said, we read each section to the athletes one-on-one. We didn't do it in groups. They each got this one-on-one to verify their understanding. So we used FAAAS 9.4 for the analysis. We had internal and external advisory boards. They were consulted. These were experts in orthopedics, in injury prevention, in sports that helped us throughout the study. We did many analyses, and I don't have time to go over everything. I do have some results, but we did frequencies, logistic regressions, and other analyses. So just a few of the results I thought you'd be interested in. Over 1,500 athletes ages 5 to 11 were observed during each year of the study. So in other words, over 1,500 were playing in the sports. We were able to do 882 impact pediatric baseline tests, and we did have then also 13 follow-ups on the children. How many Rio reportable injuries over 2 years? We had 26, but although they weren't a Rio reportable injury, our certified athletic trainer also wrote down more minor injuries. We were just curious about this, and we did have 33. The leading sport for injury in year 1 was football and soccer in year 2. Now, I've been told by people that children this young, between the ages of 5 to 11, could not possibly get concussions. Well, we did have 12 concussions that took place over the 2 years of the study. As you can see, most concussions were in soccer. And as you can see, those were mostly in boys soccer, followed by softball. And the average age for the female children who did have a concussion was 9.4, and for males it was 9.6. So anytime you do a research project, while you're happy with the results usually, you do have limitations. First of all, in order to collect the injury data, I at the most had 2 certified athletic trainers covering all these sports. So because they couldn't be everywhere all the time, we relied on coaches to also provide us the injury information. And because we were not right there, we cannot ensure the accuracy of all that data. Also, this is a problem across sports injury studies. Not all injured athletes may have reported the injuries to the ATCs. You know, the ATC did not see the injury or the child did not report it. You know, it just didn't get caught. And all recreational leagues played at one complex. We were at one huge athletic complex. So you have to be careful with generalizations. They should be done with caution. So what do I hope for the future? Well, I do hope for the future that we continue this data collection. We have probably some of the only data on children between the ages of 5 to 11 playing in these leagues. And it's going to be published soon in +1. That's a journal, an academic journal. So you can look for that, and I'd be glad to share that with all of you. But I would like to continue the data with additional sites, more diverse sites. And I'd like to include more sports. The only reason we used the sports we did is because those were the sports played at that athletic complex. I'd like to include basketball, volleyball, and also lacrosse. And I will continue the recommendations. These are some of what you see below here are the recommendations we came up with for coaches and parents based on our experience. I can tell you there's a great need for coach and parent injury prevention education. We spent a long time with them talking about injuries, and there's really a need for this. I strongly believe that leagues, schools need to hire certified athletic trainers. They need to be there for practices and competitions. They are invaluable. Not only can they treat the injury immediately when it occurs, they know what to do in emergency situations that they can't handle, and they're also wonderful for the collection of data if you need to do that. Better communication between ATCs and coaches. That took a while. We had to make sure that everyone was on the same page. They understood why we were there. We were not trying to catch them at anything doing wrong. We were just there to understand better these injuries. Consistent use of protective equipment. Sometimes children showed up with the protective equipment, sometimes they did not. So more consistent use of that. And our certified athletic trainers felt that more time on sports mechanics needed to take place during practice. Well, ultimately, what we hope to do once we expand the study is to develop targeted injury prevention programs for these young athletes playing in these leagues, because these children really do get injured here. And as I can tell you, very few researchers are looking at these young children playing in these leagues who will go on to be athletes in school settings. So I also wanted to just mention, if I have a few minutes here at the end, to talk a little bit about some efforts we're doing at the College of Public Health, not only in injury prevention, but in other areas, because we so strongly believe in policy, how important policies are and laws are to many of our efforts. I've started something called the Activist Lab at USF. Maybe you've heard of it, but the Activist Lab is done to teach students how to be effective advocates with the legislature and how also to become effective leaders in the field. That's very, very important for us. And while we do many things well here at the college, really issues of advocacy and policy development, while it's taught briefly, there wasn't a lot of time spent on it. So we're teaching things about advocacy, education. We're doing research with the students in this area. They are providing service, and we have many interdisciplinary projects and programs happening. At the end, I can show you the website as well if you'd like to see more about the Activist Lab. I also want to leave you with the thought, please remember, injuries are not accidents. We don't like that word. We usually don't use that word because we believe they're predictable and preventable. And accidents, that term, They're not. And I hope when we reach out to the state, when it comes at our different efforts, that you'll join us so that children will have a brighter future. We also have made an injury prevention video. I can show you if we have time as well. Hopefully you'll visit that. It's on unintentional injuries. We hope to add a firearm component to that soon. Thank you very much. It's been a pleasure. This is a passion of mine. I could be here for many hours. I know you probably don't want to be, but I could be here for a long time talking about injuries. So I guess now it's time for questions.
Okay, thank you, Dr. Liller. Our first question is, are the athletic trainers normally available at the recreational leagues, or were they only available due to the funding?
Yes, how I wish I could answer this question differently, but they were only available for the leagues due to the funding. However, what I can tell you about the certified athletic trainers, many times during school, they have opportunities to do internships and things. And I know that USF for a while had partnerships with different high schools in the area so that they would go to the high schools as part of their training. And so that is an excellent way to try to get a certified athletic trainer before they graduate. But they have just worked so well with us. It's definitely worth it, I think, for recreational leagues, definitely, and for schools to pursue how they can have these ATCs in the school and the other settings.
A reminder to everybody listening, we can't unmute lines, but you can submit your questions via the chat feature. Until we get any more questions, Dr. Liller, if you would like to go to your website or to show the video, that's fine.
Okay, great. Let's see if we can do this without, and you can all still see me. Okay. First thing I wanted to show was if you want to look at this Whiskers site, and can you all see that? Can you see that?
We can see your main screen right now.
Oh, okay. Okay, hold on just a minute. Okay, can you see this now?
Yes.
Okay, great. So this is Whiskers, and how I got to this, it's just the website you just do to CDC, and it's cdc.gov injury Whiskers index. And basically, if you haven't used this, I just wanted to show you an example. For example, if we use fatal injury data. If you go to fatal injury data, you will see that they have many options that you can pick, like fatal injury reports, the leading causes of death. That's how I was able to talk to you about those. But let's just go to fatal injury reports. If we go to this, you can see, first of all, it's the year range and the region that you want. For example, if I wanted to go to, I always pick 1999 to 2017, national and regional, but we could also go to the state. And we could do, for example, all intents. Take a look at that. And we could go to, let's see, all injury, and you can see what we mean by all intents there for a minute. It could be, the intent could be unintentional, but if I wanted to go to all of them there. The mechanism, we could look, let's just say we want to do all. We just want to see all the injuries. But as you can see, you could look at anything from fire and heat to poisoning to adverse effects. We also have firearms. We have transportation related, all of them, and they're all done by their codes. And then the census region, we could say United States, but also what we could do is if you just wanted the Northeast or the South, etc. And then you can do the sex. I wanted both sexes. You could do all ages, or how I get information on different age groups. I use this. I could customize it or do different groups. And then you just submit your request. And there it is. That was the first number I gave you in the presentation, that there's over 243,000 injury deaths every year. And that's as simple as it is to get this information. So I just greatly recommend that you take a look at this Whiskers site. It's a great site for people. As I said, it's fairly easy. So I think that information is good to know if you haven't used it before. And also, let me just say, it's also morbidity data as well. Okay, so we have that. Yes, I'm sorry.
That. We have a second question, and they want to know if there is evidence to show that social media use is a risk factor for suicides in children.
You know, that is a great question. Is there evidence? I am leery to say there's direct evidence for this. That still needs really study. Do I think it's a contributor, a contributing factor? Personally, I would have to say yes. I think that there is a role for this when it does come to social media. The problem with social media is that it can be everywhere at all times. So that if a child is having a particular difficult time at school and there's bullying or whatever going on, what happens is that can continue 24/7 due to social media. There's also different media sites that they can go to if they're contemplating suicide. Unfortunately, there are sites that are very dangerous that children can have access to. So is it 100% no? Probably is it involved? I would say I wouldn't be surprised if they find a real role for it, but they're still examining this. But there's definitely things that we can do, right? There's things that we can do to handle this, and one does have to do probably with social media. Another has to do with talking to children about this. Talking to them about coping and just. There's many ways. There's many prevention tools and things that you can use. But I wish, like I said, that I had 100% that I could say yes, because if we knew that, we could sort of be better at fixing the issue.
Okay. Our next question is,
okay.
Are you currently
I just put up the activist lab in case people want to see that.
Okay.
Okay.
Are you currently doing any similar research projects with adolescent injuries? And the second portion of their question is, do you recommend for children to participate and learn the fundamentals of multiple sports?
Yeah. Well, yes, we are doing studies right now. We are looking at finding a more diverse site for the sports study. And we're doing now studies that are looking at more. I've moved also now into the area of firearm violence. So we're moving into that area to better understand violent deaths in the state of Florida. And Florida just became part of the National Violent Death Reporting System, which is a CDC surveillance system. And we have been contracted to work with the state of Florida in understanding better these violent deaths, using a variety of data sources, pulling together medical examiner reports, law enforcement, and death certificates. So that's exciting. And that'll cover all ages, any violent death. As for the question about sports, let me be clear though. We've been said, oh, you just don't like sports. You're trying to hurt the sports, because they're, children need to play. I really believe that children should play sports. I really do. My children played every sport that their school had to offer. I did use the recreational leagues in the summers and vacations. Do I think they should play multiple sports? Actually, yeah. I mean, I think that is a good idea. I think what happens is sometimes you get some of these sports that you only play one sport and you spend a lot of time with it. There's a lot of games, there's a lot of activities, you do it in the summer and it's repetitive and repetitive and repetitive. And some of the literature says that emphasis on just one and the constant use of the body for that one sport can become an issue, perhaps for injury. So I'm a big fan of learning different sports. And but the important thing with sports, just like with injury prevention in general, is that they're not dangerous. It's how we practice them, how we do competition. What is our protective mechanics? Are we teaching that? Are they wearing the appropriate gear? Are they following the rules? These are the things. I know with concussions, we've seen some rule changes in different sports, which I believe has been good. But so it is great. It's a great experience for children, I think. It does provide exercise. It is an outlet. But again, it's just common sense that you just have to make sure that your child is safe when they do play. And that's everything with the equipment to talking to the coach to seeing that rules are followed. And also, if you have any question about the safety of the sport, the Hillsborough County Athletic Association has a website, and you can find all the rules and all the guidelines. So I just think parental involvement is really important here. And but yes, I think it's great for students if it's done right.
Our next question is also about parental involvement. They want to know what parents can do to encourage their student school to provide the information to students about safely playing the sports and body mechanics and following the rules to avoid injuries.
Yeah, what can parents do? Well, I think parents have a strong voice in many schools. And what I would recommend is what happened when we went to the recreational leagues. When we talked to the parents got together as a group and they actually went to the coaches and they went to the leagues and they said, is this being done? Is this being done? Why isn't this being done? Getting involved with that and with the athletics at the school is really important. Knowing how the coaches, knowing if you can possibly get certified athletic trainers. I know at some schools they're available, at some schools they are not. Opening up the conversation about that as a group of parents can be successful. So I would definitely recommend that. It creates work. I mean, there's work on the part of the parents to go there to find out. But if you have a parent organization or parent group, I would definitely talk to them about this.
Another reminder, I do see some raised hands, but unfortunately we can't unmute the line, so please submit any questions you have through that chat feature. Dr. Liller, you have some time if you want to go through the website or to show your video.
All right, great. All right, so the Activist Lab. So I told you about the Activist Lab, just if you have interest in this. And this is our graphic. A student actually designed this. And you can see it goes over on the left side, our functions. As I said, we have seminars, webinars. I recently did a boot camp to teach students about advocacy. We're doing research, etc. This year, we have focused on two issues, violence and human trafficking. And just to show you some of the links here, this is who we are. I'm the director, and then I have graduate assistants. We have a student advisory board and a faculty advisory board. Our student board is made up of master's and doctoral students, and this was at our recent boot camp. We had Representative Kathy Castor come, and she presented to the group, so that was exciting. We also had other legislators here. Some of the events we've had, we have had seminars on March 8th. We had reproductive rights advocacy by Planned Parenthood. On January 18th, we had human trafficking by Liana Dean. And also I brought the Guardian Ad Litem program here, the first Find Your Voice seminar, which their senior attorney, Michelle Bloom, talked to the students about how they can become guardians for children in the foster care system. And it doesn't take a lot of time, but they will go with the child to court and they may be an instrumental voice in what happens to the child, whether they're returned to families or not. So that was exciting. We had students sign up to be guardians. We also have a journal club. We will never advocate anything that we are not totally sure of in terms of research, and there is evidence. So we teach the students how to read the literature. We've done gun violence, media advocacy, and talking about how they can do their own research projects. We had the boot camp in January 31st and February 1, and I do something called Public Health in a Minute, which if you just go to the website, you'll see some new ones. I ask advocates who are in the academia and in the community what they're passionate about or what they're advocating for, and I give them 1 minute. Because as we all know, attention spans are not great these days. So I give them 1 minute to tell that, and we have those done. We have service opportunities for the students. This was with the Guardian program. We did a collection with them because children in the welfare system did not have clothes to go to the prom or for job interviews. So we did a collection at the college, and we ended up getting over 600 items were collected. and many different opportunities for them to serve. And then we have a resources website as well. So we're excited. The Activist Lab is growing. So I just, put it out there. So if you get a chance to ever take a look at the website, or if you want to contact me about our activities, please do, because we'd love to have more involvement. And let's see if I can go to the video if I have time. Okay. This is a video that we made a while back, and I just always like to show it because I think it brings home the point about injuries in children.
All lives are precious. What we do and how others have kept us safe helps each of us, from children to adults, to become the leaders of today and tomorrow.
I'm going to finish graduate school and become a child psychologist.
I'm going to earn my PhD in public health and become a global safety leader.
Over the years, public health research has shown us how to be protected. I am safe
because I remember to wear my helmet.
Because I always wear my seatbelt and never take some drive.
Because my mom put a fence around the pool to keep me safe.
Because I wear my helmet when I'm riding.
That I always use my car seat.
Because I put my daughter to sleep in her own crib and on her back, she can grow up to be anything she wants to be.
At the University of South Florida College of Public Health, we work hard every day to make lives healthier and safer. Since injuries are the leading cause of death for children and young adults, college researchers have developed injury prevention programs and have been instrumental in the passage of injury laws and policies. Please visit our website or come see us in person to learn more about the college and how you can join our efforts to reduce injuries. Our practice is our passion, and together we will change lives.
For anybody interested in watching that video again or sharing it with any of your partners, it is included in the handout section. It is the handout labeled presentation resources, so you can use it again. Dr. Liller, do you have any closing comments before I get to mine?
Well, no, I just want to thank you all again for being here. If you have any questions that you didn't get a chance to ask, please just email me. I'll be glad to answer them. It was a wonderful opportunity. I love to talk about injuries and injury prevention. I wish we had more time. We've done a lot of work in all those different injuries you saw in the video. But I think it's just important to remember that, again, injuries, they're not accidents. They're preventable. They're predictable. They're things we can do. And I just wish everybody a safe day and a safe summer.
Well, thank you, Dr. Liller. I want to provide a second announcement about the continuing education. For those who would like to receive continuing education credits, please fill out the survey that will pop up at the end of this webinar, or the survey that will be sent to you via the participation email. You do not have to complete both, just finish one. We are only providing nursing continuing education credits, and to receive those, you have to put your name, license number, including the prefix, whether that be RN, ARNP, etc., and make sure the number is correct. Our next presentation will be on May 14th at 10 a.m. again, and we will be featuring Dr. Mary Ann Burge from the University of Central Florida. She will be presenting on the differences in clinical outcomes and quality of life of women diagnosed with cancer. For those of you located in Orange County, we welcome you to join us at the Health Department. To register for this presentation, please visit the Florida Health Grand Rounds website or follow the e-guide that will be sent out in the upcoming weeks. Once again, a special thank you to Dr. Liller today for the wonderful presentation, and have a great day.
Thank you all.